Welcome everyone to week 3. This week we're going to talk more, read more, watch more about who actually commits some of these crimes. Who are the perpetrators? The Association of Certified Fraud Examiner has a report to the nations, which is one of your readings this week, that gives details as far as age, gender, educational level. We're going to look at that. We're going to take a look at the victims of the schemes. Of course, the healthcare payer system, which is Medicare or Medicaid or commercial payer, is one of the victims. But sadly, in many cases, it's a patient that sometimes even dies due to the healthcare fraud scheme. Right now, the United States is facing an opioid crisis, and there's many good white papers on opioids and healthcare fraud involvement. We're going to look at how the fraud scheme occurred. Was it coding? Overprescribing of medications that wasn't needed, keeping patients longer than they had to be kept in a hospital, perhaps not even, they didn't need to be admitted, but admitting them. Perhaps they were providers that had fake credentials. These are some of the schemes, and we'll learn of some more. We're going to look at the involvement of whistleblowers. One that you're going to read about is Dr. Sam Foote, who helped expose the VA fraud that was going on a couple years ago. He worked at the VA system in Phoenix. Whistleblowers go forward, often jeopardizing their career and livelihood in order to stop healthcare fraud. So we'll look more at whistleblower involvement in healthcare fraud cases. We're going to dissect some healthcare fraud cases where you're going to actually write and tell me who you thought the perpetrator was, who the victim was, and what type of scheme was it. And I'm going to involve you in the CMS Medical Learning Network webinar system, where you can actually see what healthcare providers have as a tool to learn more about healthcare fraud and abuse. This is going to be a great week. I hope you enjoy it. I look forward to reading your discussions, your assignments. Have a wonderful week.